novel coronavirus outbreak appeared in Wuhan, China in December 2019. Since then, there have been more than 24,000 confirmed cases, resulting in over 700 deaths. The new virus has now reached more than 20 other countries, with over 190 confirmed cases, and the numbers continue to rise. The virus is part of a large, long-standing group of coronaviruses that have different strains. They cause infections ranging from the common cold to the more threatening severe acute respiratory syndrome, SARS. The novel coronavirus strain exhibits symptoms similar to the flu.
The common symptoms tend to be fever, cough, shortness of breath, and difficulty breathing. It can also cause severe disease leading to pneumonia, severe acute respiratory syndrome, kidney failure, and death.
To date, there haven't been any confirmed cases of the novel coronavirus in Trinidad and Tobago. However, the Division of Health, Wellness and Family Development, through the Office of the County Medical Officer of Health, isn't taking any chances.
We would get advance information as to if there's someone who has traveled from China on a flight. We make sure and screen those flights, and we can demonstrate to you the infrared thermometers that are being used. So we're screening persons, all passengers on such a flight, to see if anyone has a fever. Anyone who is detected with a fever is then interviewed and investigated by the surveillance unit as necessary.
Awareness sessions have been held with several key agencies. These include the Tobago Emergency Management Agency, the Airport Authority, THA divisions, the Port Authority, the Tobago Regional Health Authority, and immigration officials.
We have ensured that they have increased infection prevention and control measures at the healthcare facilities throughout the island. In addition to sharing information with the private physicians on the island via email, we will be having a meeting with them so that we make sure that all healthcare providers on the island have the capacity, if a case were to occur, to know how to manage the case.
It can take up to 14 days for someone to develop symptoms after being infected. The virus is typically transmitted through the air from coughing and sneezing, from close personal contact, or from direct contact with contaminated surfaces. The public is also being advised on how they can protect themselves.
Washing hands frequently with soap and water for at least 20 seconds. If soap and water is not available, persons can use alcohol-based hand sanitizers, but just to note, if your hands are visibly dirty, hand sanitizer will not work. You have to use soap and water. You should not touch your face with unwashed hands, especially your eyes, your nose, and your mouth, because if you touch a surface that's contaminated with a virus, and then you touch your eyes, nose, or mouth, you can become infected with the virus.
The 2019 novel coronavirus is transmitted from person to person, so if you're sick, you should stay at home. Try to keep a reasonable distance from others and disinfect frequently used items such as desks, door handles, and telephones. Research continues into this new viral infection, so residents are encouraged to do all they can to reduce the potential for spreading the disease. I'm Omodara for Let's Talk Tobago.